And let's get started. Share. Okay. All right, let's get started on week 2. So this week, what we're going to be going over is we're going to review for frontalis and how to inject somebody's frontalis. And then we're also going to go over the toxin expiration rules. And then as far as MFL operations go, how you offload product and then how to label and store neurotoxin. And then we have our AR review, how to apply promotions, and then also how to accept wallet payments. And then we obviously have our marketing stuff today. Okay, so let's talk about a frontalis. So the frontalis is a medium muscle group. So think back to training. I remember you have large muscle groups, you have small, and then you have medium. So a large muscle group can handle 10 fluid units into each injection point, and then a medium muscle group can handle 5 fluid units into each injection point, and then a small can handle 2.5. So think back to training. When I talk about fluid units, I'm essentially talking about insulin units on the insulin syringe. If you're reconstituting dysport at 3 mLs, fluid units equal dysport units. So it makes it super simple. So for a medium muscle group, it's 5 fluid units. So 5 dysport units, 5, 5, 5, 5, 5, 5, 5. 7 injection points is standard for a normal sized forehead. If a patient has a small forehead, then it will be anywhere from 4 to 5. If they have a large forehead with rainbows, then it will be those 7 injection points with 2 additional ones kind of up in the hairline. And I usually treat those as 2.5. Let's look at some different, wrong one. There we go. And you're going to tell me if they are a large or small forehead. What would you classify this patient as, large or small?
Large.
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 Yep. And this is exactly how you would mark this patient. So between the pupil and that lateral canthus, kind of in between, like right at the edge of the iris, straight up, you do want to make sure you are 2 centimeters above the eyebrow so you do not cause any type of ptosis or eyebrow drop. If the patient is naturally hooded, I actually will put this particular injection point about 0.5 centimeter to 1 centimeter above this, and that will make sure that the frontalis muscle will continue to elevate how it naturally does. Remember, when you put neurotoxin into a muscle, it forces it to do the exact opposite. So normally, or God made the frontalis muscle to be an elevator. When you freeze it, it becomes a strong depressor. Then walking across the forehead, it's medial canthus straight up, and then again, a medial canthus straight up. And then again, it's usually right at the edge of the iris, kind of straight up. And then for a large forehead, you're now going to go pupil all the way up, nose all the way up, and pupil all the way up. Now, these are just kind of generalizations. Every single patient is going to be different, but what I teach you in training is at least you have to start somewhere. And then as you start to practice, you can become more comfortable with each patient's anatomy and how you need to tweak it as you progress. Next patient, large or small?
Medium.
Large or small forehead, sorry.
Large.
Very large, right? And she also has a rainbow right here, right? So she has a little rainbow right here, and then she has a little rainbow in there. So I would do the standard 7, and then I would do some rainbows kind of right at that hairline right there. And so this is actually how I mark this patient. So you can see, again, I'm a good 2 centimeters above on and then above her eyebrows, and then I also hit with her rainbows. Okay, what about this patient? Large or small? She's got 1 rainbow right here too, right? She's got 1 rainbow on one side and not on the other. And this is how I mark this particular patient. Okay. And then what about this patient? Large or small?
Small.
Yep, very small.
Small.
Yep, small forehead. So she just has a 4 on the base, and then she just gets 1 right at the top. So did that kind of help y'all remind you of what we did in training? Or for anyone who passed the oral exam, that's how we teach basic neurotoxin for frontalis in training. Any questions about the forehead? Nope. Perfect. Okay, so let's talk about our toxin rules. So, whenever you get a brand new vial of neurotoxin, you do need to make sure that you label it, and you also need to put on there how you reconstitute it. The reason why we have you do that is because we have some injectors who might use 1-to-1 ratio for Botox, Jeuveau, or Dysport. And if you do get one of those vials, you need to be aware of that. And so, please put on there how much you reconstitute it with, and then also the date that you reconstitute it. The neurotoxin must be refrigerated before and after reconstitution. And that includes Botox, Dysport, and Jeuveau. The only neurotoxin that does not have to be reconstituted prior to reconstitution, there's actually two of them, and that's going to be Xeomin and Daxxify. However, after reconstitution, they both need to be refrigerated. But for my face lady purposes, all three neurotoxins that we carry do need to be refrigerated before and after reconstitution. They also must be used within 60 days of opening the bottle. Okay, so if you're going to be getting a brand new bottle, please make sure you use it within 60 days. If you are not going to be using within 60 days, then it is your responsibility to offload that product into another injector or try to get it back to corporate so we can put it back into circulation. But one bottle of Botox or Dysport or Jeuveau is essentially treating like 2 or 3 patients. So you should be able to kind of use the entire bottle. If it's getting to that time, kind of put something out on Facebook saying, hey, I have a last minute opening for any patients available, let me know. And then that way you can try to push using all of that bottle. Any questions about our current toxin rules? Sounds good. So this is how you are going to be labeling the product. You put your initials, the date that you reconstitute it with, and what you use to reconstitute as far as the milliliters. And then also you can put on there how many units you used out of the vial. This just kind of helps you. Obviously you have traceability, but if you just want to look real fast in the back of the bottle, you can automatically look for that as well. Okay, so how to order product. So this link is available on the Facebook page. It's also available in Bamboo. If you go to any of the Facebook pages, either your onboarding group or once your onboarding group is, once you are out of your onboarding session or your group, you can then go on to the All MFL Injector page and search in the search bar or product order link. And then you can find that link. Just save it in your phone. It makes it significantly easier whenever you need to order product. We do ask if you just have like one patient or so, you go to your districts first to look for product before you order a brand new vial from corporate. Also, if you just have a small touch-up, like if you just need to do a little eyebrow lift or lip flip or small little touch-up, please do not reconstitute a bottle for that unless you have plans to use the entire bottle. Please make sure that you are getting an open bottle from one of the other injectors before you order product. Any questions with that? Okay. I mean, and as far as like moving product around, I don't offload product ever. Like if I open a bottle, I use it within 60 days. So there's really not a reason why you should have to offload it. So I know that seems like it could be really stressful, but you have 60 days to use the entire bottle. At that point, you just need to start going on Facebook and any type of social media page or anything just to put it out there that you have some product and you know, if you have an opening or something, just so you can get it used. Okay, so let's talk about promotions. So MFL offers promotions throughout the year, and it's really simple to go ahead and apply them. Same thing with the virtual wallet. Now, a patient will have money in their virtual wallet for a couple of reasons. The first is if they are a VIP member, then money automatically goes into their virtual wallet. Or if they accidentally tip you, you can go ahead and you can put money in their wallet. Or if you are going to be accepting Ally rewards, you have to go in and manually put it into their wallet as well. So those are the reasons why you would be using the virtual wallet. But I'm going to show you how you're going to apply those. So the first one is going to be that last procedure that we did. So that's that Dysport and that consultation fee. Since I used Dysport, you can see that it was automatically calculating the Aspire rewards in the back, and this current patient does not have any Aspire rewards available at the time. But if they did have any rewards, what you're going to do is you're simply going to go over to, you can go over to Wallet or to Promotions. And for the promotions, you just simply click on the promotion that you would like to apply. So if you have a family or friends discount, or if it's a launch party, or if we have any other promotion going on, simply click on it underneath promotions and it will automatically take it off of the total. Now for the wallet, for Aspire or Evolus, all of that is going to be housed in the wallet side. So you can see this one particular patient has 600 points. Let me see if it'll let me use them. So you click on the amount of points that they have, and then you can choose how much of those points that you want to redeem for the patient. If I click on 60 Aspire rewards, that will take all 600 points away. So I will click on it, and then I will click send code. They will automatically send the code to the patient, and then you can apply it, and it will automatically subtract it from there. So pretty simple. Same thing with the Evolus rewards. So this patient also has some money available in their AR wallet. Whenever you go to their AR wallet, it will show the balance, and you will click charge if you want to use the entire amount, and it would subtract that $10 from that patient. So you can see from here, the total amount was $320. I apply $10 of the AR wallet. The patient's new balance is $310. Very simple. Just said it twice. Okay, so if a aesthetic record, like I had told y'all the last call, sometimes Evolus, and that's the rewards for Juvo, sometimes they lag a little bit on their magic codes. So if the magic codes do not match with what the patient is getting, you will have to do it we call it the back end way, but it's not the back end way. It's really the way that everybody else in the world outside of aesthetic record does it. And so you simply go to the Evolus website. So it's www.evolus.com. And then you would log in, and the login is on the Bamboo page, and it's also on the Facebook page as well, as far as a username and password. So please keep that for your reference saved. Once you log in, so the username is myfaceladyrewards@gmail.com. And then that password is going to be myfacelady1. You can then type in the patient's phone number. And if the patient has a reward available, then you can go ahead and you can say send magic code, and then you can do everything on the back end. And then once you get that $40 off, you would then go into the patient's virtual wallet and add the money there, and then you could subtract it. So pretty simple procedure. Good. All right, so let's talk about our marketing homework for the week. So this week, you're going to continue to reach out, planning your launch party. So you're going to reach out to 10 more people on your Frank list, and you are going to either one, invite them to your launch party, or ask them if they are available for you to treat them as a patient after your launch party. You are also going to post one time on social media with a graphic that I'm going to provide you, and that is a before and after of neurotoxin of a forehead. So I will post that graphic for you on the Facebook page. And then the last one is going to be a post that you are going to create. And this is going to be an education post about the benefits of neurotoxin. So either you can make your own graphic, or you can simply just type something up. But I'm really trying to get you used to doing different types of media for your social media. So you're going to have a graphic, and then you're going to have some words that you're going to create. And this is just the foundations that you can continue to build your social media following. This week is also the week that I have you start following additional trainers and additional accounts on Instagram. The first one that you're going to follow is the AAFE. They are a great program. They're another training program. He does a lot of education on Instagram. He does a lot of videos. And then the second one is going to be Injector Bunny. Now, AAFE does a lot of kind of basic training, which is great. Injector Bunny does a little bit more advanced things, but it's really it's a good thing for you to try to learn all different types of techniques and procedures because, like I told y'all in training, be a sponge and continue to learn. So these are two great people to start your social media following. And every single week from here on out, I'm going to be adding additional people that you need to follow. So that is it for this week. What questions do y'all have for me?
I had a question. Can you explain the VIP program again?
Yeah.
Like
So
how it works?
Yes, the VIP program, it's $49.99 or essentially $50 a month. And they prepay for 1 month up front. And then all of that money goes into their virtual wallet and it expires after one rotating year, rolling year, I should say. And they can use all of that towards any procedure at My Face Lady. And it also gets them a set discount with all neurotoxins and any procedures that we do. I believe it's 5% discount.
Thank you.
Yep. Any other questions?
Okay, on the Ally reward points. So does it, whenever you put in the patient's phone number in their account, is that how it links their Ally
Yes.
account to it? Okay, so, okay.
Yes, but for Ally, you will not be collecting those rewards. We have Bernard. He actually does it on the back end, so you don't have to do that. You can simply just have them show it to you, and then once they show it to you, then you can go into their virtual wallet and add it, and then Bernard collects it on the back end. So Ally, you don't have to do anything with outside of put it in their virtual wallet because somebody else collects that for you. Aspire and Evolus are the only ones that you have to do, but it's integrated within the app.
Okay.
Nikki, did you have a question? Nope. Somebody else had a question. Has everyone been assigned their onboarding specialist?
Yes. Yes.
Perfect. And everyone has reached out to them already?
Yes. So we, Christy, Addie, and Gracie have our launch party on March the 7th.
That's exciting. Are y'all doing it together?
Yes, we're all doing it together, and we've already created a little invitation and sent it out for, I've sent it to quite a few people, so I'm sure they have too.
Awesome. Awesome. That's super fun to do it like that. All right. Any other questions for this week? Perfect. Okay, so before we get off, I'm going to go over real quick. Let me find it. Okay, I'm going to ask y'all some questions. So we're just going to kind of review real fast. How do you reconstitute Botox, Dysport, and Juvo on label? All three of them are what? 2.5, and Dysport has an additional one of 1.5. What do we reconstitute Dysport at MFL with?
3.
3, very good.
3.0.
True or false? Botulism toxin produces paralysis by blocking the presynaptic release of acetylcholine at the neuromuscular junction. True or false?
True.
True.
Name the muscles that make up the glabella complex. There are 2. They are what? Procerus and the
And then
corrugators. Very good. And remember the corrugators, as it goes out, it gets more superficial and thinner. So when you do inject the tail or the lateral tail of the corrugators, you have to change the angle and the depth of your needle. Otherwise, if you go to straight down, you would accidentally hit the frontalis. And that is the main reason that people cause a lid ptosis. How long is it recommended for a patient to wait before getting a neurotoxin touch-up? How many days?
14 days.
14 days. Very good. Name one way that you can treat a brow ptosis. I told you 3 in training. They are time, toothbrush, and and a brow lift. That's for a brow ptosis. So remember, if you want to do a brow lift, you're going to be treating the orbicularis oculi right into the hairline, and you can do either 1 or 2 injections, either right at the tail of the eyebrow or 1 centimeter in for a more medial eyebrow lift. Number 6, what allergy be concerning for a patient wanting to receive Dysport? You remember what that was?
Protein, cow's milk.
Cow's milk protein. Very good. When selecting dermal filler for a patient, explain G prime as it relates to filler rheology. It is the thickness and the viscosity of the filler, correct?
Mm-hmm.
What is the name of the enzyme used to dissolve dermal filler? Hylenex. Hylenex is the brand name. It's also called hyaluronidase. Who should not receive neurotoxin? Pregnant or breastfeeding women, a history of allergy to neurotoxin, a history of neuromuscular conditions such as MS, or all of the above?
All of the above.
All the above.
What are the lines called that are etched into the skin due to constant movement and can be seen at rest? Are they static lines or dynamic lines?
Static.
Job. On average, when will neurotoxin begin to break down after injection? How many weeks is it?
6 to 8.
6 to 8 weeks. Remember, at 6 to 8 weeks, that's when that SNAP 25, that telephone pole starts to get rebuilt, and that communication will start back up at around 6 to 8 weeks, with the patient receiving full communication or full range of motion at 3 to 4 months. Name one way that you can treat a lid ptosis, a true eyelid ptosis. There are 3 ways: time, tooth, or upneak eye drops. Those are the drops that work directly on that levator muscle that will pop open that eyelid, and they last for about 6 hours or so. It is a prescription. What muscle turns the frown upside down when injected with neurotoxin in the lower face? What is this muscle right down here when you frown? What is that called?
Yeah. No.
3 letters.
What's your DAO?
The DAO, the depressor anguli oris. Explain how you would treat a spot eye. Remember, this is after you've treated the patient. You've made them wait 14 days. You're going to have the patient come to you, and they're going to lift up their eyebrows. You're going to see where their frontalis is still active, and you are going to treat it. You're going to knock it out with about 2.5 units of Dysport, which is the equivalent of 1 unit of Botox or 1 unit of Jeuveau. What is the standard dosing for crow's feet using Botox and Dysport per side? So let's just talk one side at a time. Let's do Dysport first. It is typically 3 injections with 5 fluid units into each injection point. So 15 per side. So 15 and 15 for Dysport. For Botox or Jeuveau, 5 equals 2. So you would still inject that 5 fluid units, but you're going to chart 2, 2, 2. Name 3 characteristics of the skin that you could see with a vascular occlusion. Let's talk about the 5 phases of a vascular occlusion. Those are blanching. Then you have that reticular lacy pattern. Then you have the vesicles. Then you have skin breakdown, and then full thickness necrosis. What major blood vessel branches up to the angular artery as it travels to the upper face? What is this main artery right here?
Facial.
Yep, your facial artery. Very good. What medication and dosage is prescribed prophylactically for a patient with a history of cold sores wanting to receive lip flip or lip filler? Valtrex. 2 grams.
2 grams
So
PO.
BID times 1
1
day.
day.
Very good. What is the best way to prevent a delayed onset granuloma from forming? Remember, there are 3 ways again, and that is patient selection, product selection, hand hygiene. The best 3 ways to prevent that delayed onset granuloma from forming. And those are the ones that form like 6 to 9 months after you've injected the patient. And then what is the name of the muscle you want to avoid when you are injecting the masseters? What muscle is right here in front of it? Starts with an R.
The risorius.
Risorius muscle. If you accidentally hit that risorius muscle when you are injecting the masseters, it can cause an uneven smile. So remember that. Also, we talked about whenever you are injecting the masseters, it really is essentially it's like two muscles built into one muscle. You have the deep muscle, and then you have the superficial muscle. The purpose of that superficial muscle is really to kind of act like a trampoline to hold the deeper muscle down. So what that means is you have to use a longer needle to reach that deeper part of that muscle. If you don't, what will happen is if you just relax the superficial one, that trampoline won't hold that muscle back anymore, and then you'll get like a walnut kind of bulging out. And that usually happens around 3 or 4 days once that neurotoxin starts to kick in. So when you are injecting the masseters, make sure that you inject deep and superficial using at least a 1/2 inch needle for the masseter injection. Okay. All righty. Well, that's all the review I have today. We're going to continue to review every single time we do this, and I'll kind of continue to add additional little education in there for you so you can continue to build upon some of the tools that we gave you in training. Does anyone have any further questions before we end the call tonight?
No.
Perfect. All right, ladies. Well, I hope you have a wonderful evening, and we will see you next week. I will post this call probably tomorrow morning. Have a good night.
Bye. Thank you.
Bye. Thank you.
Thank you.
Thank you.
Thank you.